I don't know that there's anything really extra than what I put in there. Just has been brought up before by different employees, and I didn't know exactly whether I was supposed to take care of it or somebody else should, but since it hadn't been brought up before, and it's just, you know, so every once in a while we'll have an employee that gets taken to the hospital for whatever reason, and then the question always comes up, well, how come we're not participating providers with, you know, through the city insurance? And so I just decided that this would be kind of a time to take a look at that, and I can do whatever you want as far as continuing to build the way we are. It just seems to be more of a win-win situation for both the employees and the city, with the employees not having the expense over what our insurance pays, and then the you know, the city doesn't have then those claims to look at whenever they're looking at new insurance premiums for the next year. So, does that make sense? Yes.
Yeah. One of the statements in here says that it will save the city money because of that. Percentage.
You know, that's something that's a little hard to take a look at. Like I said, there haven't been that many calls over the span. I think I put in there, I believe it's 25?
Yes.
Since 2003. So you're looking at 7 years. If you, I mean, I didn't necessarily look back to see how many calls within each year, and then we've had different increases, you know, at different times throughout these last 7 years. So I don't know that I could go back exactly and tell you how much it's going to cost. It just, that would be more of something you would need to ask an insurance company as far as when they go to figure out what they're going to charge the city for insurance premiums, what they take a look at, and how many times, you know, we've had the calls that we've had to bill on the city insurance.
So, and
it's minimal. It's, I mean, you know, whenever you consider we've only had 25 calls, if I counted correctly, in 7 years, it's not a huge savings, but at the same time, it's something, you know, that we can take a look at as far as that, and then it's a minimal amount that we're not charging the employee.
I understand why you've done this, okay? Don't have a problem with that. Two questions that we don't have an answer to is, we assume it will save the city money. We don't know, right? Would that be reasonable to say?
Well, yeah, I guess that's true.
Because we don't have the numbers for it,
yeah.
So we don't know. Two, part of the problem with the healthcare system that we have now is that, for instance, and I'm not saying it's going to happen, but when something is free as such, the perceived value is also free.
Okay.
How do I know this? Where's the first place you go if you have good insurance? You go to the emergency room. Where's the most expensive place to go if you have insurance? The emergency room. And that's exactly what's occurring. Now, am I going to say this is going to be abused? I don't know. But if the value of it, right now, I won't use an ambulance unless I have to. I'll guarantee that. Because I know it's going to cost me. I know how much my insurance covers. I know how much I'm going to pay. This is my concern. If it's free, that's exactly what it is to the person using it. It's not free to the city. And that is a concern. And, you know, I'm not trying to shoot you down, but I'm just trying to tell you this is what I see. And everything I've ever done free, all of a sudden my time is typically worth nothing either.
Yeah, it may be, I don't know. And, like I said, it's just been brought up before. The last time was when we were working on the employee handbook, and it was mentioned again, how come we're not participating providers? And that part of it, I can, you know, that's a very hard thing, time consuming as far as, well, I think I explained it a little bit, to some extent. If we're a participating provider for, like Blue Cross Blue Shield right now, because that's what we've got, then we would have to be a participating provider right off for everybody that has Blue Cross Blue Shield. But if we just simply make it a benefit, like the health insurance is, then we're not having to write off, you know, for everybody else. It's just for the employees that happen to use it, so.
And then
Like I said, it doesn't make any difference to me.
No, and I understand. And then the one other thing on Medicare and Medicaid. We're participating not because we have
Want to, yeah, not because we want to, no.
Yeah, we got stuck with that baby. Yeah, so, you know, no, I do understand what you're saying. I understand how it would be a benefit. I hate to be devil's advocate, but that's what I do. So, those are my two concerns. But anyone else can speak.
I think that was also one of my concerns. I just wanted to make sure that I understood the last sentence here correctly. If we agreed to be participating providers with the insurance carrier for the city, that would mean no matter who you serve, if they had that insurance carrier, you would be writing off those charges as well.
Yes, and
So
that's why we've never become a participating provider.
So as becoming a participating provider, this potentially could cost the city.
Yes, definitely. If we became participating providers, yes, it would definitely cost. You know, especially like with Blue Cross Blue Shield, besides Medicare and Medicaid, that's probably the next largest insurance company that we work with. So yes, we would be having to write off a lot if we did that. And so I would definitely suggest that we not even look at that situation. Just besides the fact that any time we change our insurance, then we'd have to go to the process of negating that with that company and changing it with the next company. So no, I would not suggest doing that, you know.
Ruth Ann, now, when you say that you're writing off, you're writing off the amount above 500, basically, or whatever they allow.
Right.
So you're getting that first 500 and you're writing off the excess above that.
Not for employees. With Medicare and Medicaid, when we bill, let's a round number, let's just say we bill $800 for a call. Okay, they would probably say that they would approve about half of that, around 400. They would then pay about 80%, and a secondary insurance or the other person would have to come up with it. So ultimately, we would only receive $400. Right now, with the insurance that we have, whether it's an employee or another person in town, when we bill insurance, we don't have to write anything off. And the insurance pays whatever they're going to pay if deductible is already met, and then the patient, whether it be somebody in town or us, pays the rest of it. So we don't write anything off at all for the employees.
When you're not a provider.
Right.
Okay.
Right.
But by becoming a provider with city insurance, you would be paid whatever the provider determines is allowable, and then above and beyond that would be written off.
Exactly.
So do you find though that it's do you find though that it's better to receive a payment, an allowable payment from an insurance company rather than billing a customer the entire amount and then having to make payments and maybe there's non-payment?
You mean just generally with the general public, you mean? Or just with the employees?
Anyone that you transport. Anyone that you transport. If you're a participating provider, you're guaranteed a payment from the insurance company of the amount that they determine that's allowable.
Right. Yes.
That's a guaranteed payment,
right,
rather than you billing the entire amount because you're not participating, and then you're.
And then we don't know whether we're gonna get paid or not.
Right.
Right. I haven't really sat down and taken a look at the numbers of how many people that maybe we, you know, have done that with and then ended up not paying. So that would be kind of hard to say. We just have never been a participating provider with anybody except for Medicare and Medicaid, so.
In the current situation, if something were to happen and somebody working on the street crew and they have to be taken to the hospital, how much do you get from our current insurance company?
Well, that's a different situation because if they're working
Okay,
for us, that would be
let's take
workman's
that
comp.
out,
Yeah.
Bad example.
Yeah.
After hours,
Right.
we're taking them to the hospital, and how much does the insurance pay at?
$500 on our city insurance right now.
Okay, so instead of wiping the slate clean and not gaining any money for the work that your team would be providing, why not set it up where we just write off everything above what the insurance company pays?
We can do that
for
too.
the city employees. That way we're at least getting some money for the expense of the fuel, your time, your team's time, and it's still not a financial major impact to the employees.
I think that again comes back to what Alderman Sparks was talking about. As far as it's free, then you're gonna be more apt to use it more often than you would if it wasn't. I have to agree with that.
You know, and
I mean, we could then look at building in, say, maybe a small premium or something in on top of that the employee would be required to pay for each, say, each trip's $100 plus whatever the insurance pays. I think there's other ways to look at this instead of just saying it's either all or nothing.
Right, and that's
it is my assumption, and I believe I'm correct in this, that the reason why it's $800 base, $10 a mile, is what we have determined our costs are. That's how we figured it.
Right.
So what we are doing, I understand that there's a lot of things we can do, but either way, you are going to be taking a part of the city that already runs deficit and run it further. And so I think these are just the things that we have to consider all this, because we know we did $800 is because we figured out what it cost. So it's entirely up to us. We can spend the money however we want to. But consider that as you're looking at your budget too.
And if you need the service, paying the money over what your insurance pays is usually well worth it.
You will, yeah. My little car wreck, I really appreciate it.